So, welcome. My name's Andrea Miriam. I'll be facilitating today's program. I'm the CEO of PMD Alliance, and we're so thrilled to bring this topic to our proactive brain health audience. So, as a facilitator, let me go over just some housekeeping items. Today's presentation is being recorded, so you can sit back, listen, learn, and know that you can refer back to the recording as well as get copies of the slides later on or even to share. I know a lot of times in our audience, maybe there's a genetic risk across a family, and many of you might be joining to learn on behalf of a family member. So, welcome, welcome. Let's see, we want today's presentation to be interactive. So if you have questions, if you have comments, we always want all of our audience to learn together, but also apply what you're learning to your own situation. So please use the chat function to send over questions, clarifications, comments. And after the lecture portion, I'll moderate those over to Dr. Eva Schaeffer. I was practicing my German pronunciation this morning, so please forgive me. But let me introduce you to our international world-renowned speaker here. So from Germany, but actually joining us from France today. So we have Dr. Eva Schaeffer. She's a neurologist and deputy head of the research group at the University of Kiel in northern Germany. So I don't know if anyone knows their German geography and their German universities, but we're so thrilled to have Dr. Schaeffer here and joining us from the evening. So welcome, Dr. Schaeffer. And before you put your slides up, can you tell me a little bit more about your research group at the university?
Yes, of course. Well, first of all, I'm very happy to be here. I'm honored to be here. It's such a great connection here. So, as mentioned, I'm from Kiel University, northern part of Germany. We have a specific research group for early Parkinson's disease and the prodromal phase of Parkinson's disease. We also have, which is quite new in Germany, a specific outpatient clinic for early diagnosis of Parkinson's disease, where you can come if you have specific symptoms that might be an indicator of Parkinson's disease, or you have a risk profile. Maybe you have someone in your family, or you have had a connection to pesticides, or so on. And we are very specialized in that. And I have been working with individuals in the prodromal phase for over 10 years now. And this is really a topic very close to my heart. So thank you very much for inviting me.
Yes, thank you, thank you. So I think you have some slides to accompany your talk. So if you bring those up, and then I'll pass the floor and the microphone over to you.
Thank you very much. I hope you can see the slides now. So the topic I want to discuss with you today is actually a topic that is really close to my heart because I want to discuss with you potential ethical issues or ethical implications that might come with early Parkinson's disease diagnosis and with early risk disclosure. So today I want to weigh with you the pros and cons of getting to know your risk. And what is really my goal for this talk is that at the end of the talk, you will be empowered to decide for yourself if you want to know if you have a specific risk, or maybe you do not want to know it, which is also perfectly fine. So I'm quite sure that most of you joining us today have a profound knowledge of Parkinson's disease, and maybe you've read a lot and have really a great expertise, but there might be also one or two who maybe are new to the group. So I just want to quickly introduce what is important for Parkinson's disease, because this is also important for the ethical issues I want to discuss. So first of all, what is Parkinson's disease? We know that the basic pathology in Parkinson's disease is an accumulation of a specific protein, which is alpha-synuclein. Many of you may have heard it. And it's important to say that we all have alpha-synuclein in our body, in our brain. But in Parkinson's disease, the problem is that this protein misfolds in a specific way, and this leads to an aggregation and accumulation in nerve cells. And one of the most important problems in Parkinson's disease is that this aggregation of alpha-synuclein is in dopaminergic nerve cells of the substantia nigra, specific part of our brain. And we all need dopamine to move. And if we do not have enough dopamine, we get some kind of motor impairment. But what is also important, and this is very important for the prodromal phase, is that we can find this alpha-synuclein aggregation also in many other parts of the nervous system, in other parts of the brain, but also in other parts of the peripheral nervous system. We can find it in the skin, we can find it in the gut or in the spinal cord. So it's actually a disease that not only is limited to the brain, but can affect many parts of the nervous system. And that's why the symptoms are very different. So each patient is very individual with Parkinson's disease. What is leading to our diagnosis of Parkinson's disease and what is caused by the loss of dopaminergic nerve cells are the motor symptoms. You may have heard it in Parkinson's disease. You can suffer from slowness, rigidity, or tremor. But what is also very important for quality of life and for the diagnosis of the prodromal phase are the non-motor symptoms, which can be, for example, constipation, an impaired sense of smell, neuropsychiatric symptoms like depression or anxiety. And when we think about Parkinson's disease, many people still have this picture in our mind. But we have to say this picture has been drawn in the 19th century when James Parkinson actually defined the disease. And we know now that in the 21st century, Parkinson's disease can look very different because we can actually treat it very well. I know from my outpatient clinic that Parkinson's disease can also look like this. And of course, this is an AI generated image, but I actually asked ChatGPT to draw this image according to a picture I got from my patient, who was very, very happy that after 16 years of Parkinson's disease, he was still able to climb his favorite mountain in Germany. So this is very important to mention right in the beginning. Parkinson's today is very different from what we may have had in our mind like 20, 30, or 50 years ago. We have a lot of treatments. But what has been in the center of attention in research, and we did many, many studies with individuals in the last years, is this prodromal phase you all have heard of. Let me just quickly summarize what we know today for the prodromal phase. As I mentioned, we know that at some point during the disease, the Parkinson's disease, nerve cells get lost. And what is very important and very interesting is that the actual motor impairment starts very, very late in the course of the disease. So only after more than 50% of the dopaminergic nerve cells are already lost, we can actually see the motor symptoms and can diagnose the Parkinson's disease. And from this point on, we are talking about the clinical phase of Parkinson's disease. Before that, in the beginning, before the disease even starts, there is what we call risk phase. So we all may have some risk factors for Parkinson's disease. For example, male individuals are a little bit more likely to get Parkinson's disease. Non-smokers, we do not know why, are more likely to get Parkinson's disease. There might be some family background that leads to a specific risk constellation. But what is most important, and I want to talk about today, and you are all interested, is the prodromal phase. And this is so important because we know this prodromal phase can last a long, long time. So phase where nerve cells are already getting lost, where the disease spreads throughout the nervous system, but we cannot make the diagnosis yet of clinical Parkinson's disease because we do not see these motor symptoms. And as mentioned, this can be up to 20 years. So really, really long time window where we actually would like to diagnose individuals earlier and maybe in the future treat them earlier. So for this early diagnosis of prodromal Parkinson's disease, it's very important to know that there are some early symptoms that can occur in the prodromal phase are very unspecific. Some of them are quite specific. So for example, if you have an impaired sense of smell or if you have constipation or depression, these are very unspecific symptoms. Of course, not everyone who has constipation will get Parkinson's disease. It's just the other way around that many people who develop Parkinson's disease later tell us that they had some kind of these symptoms in the years before they were diagnosed. And there's one more specific symptom, which is REM sleep behavior disorder. Some of you joining us today may have this sleep disorder. So the question we were asking ourselves for the last years was, is it possible to diagnose an individual already in the prodromal phase of PD? And we have made a lot of progress there because in the last really few 5 to 10 years, we got new biomarkers. There are many, many interesting biomarkers, but the ones that are currently most interesting is that we are able to detect this misfolded pathological alpha-synuclein in different fluids and different tissues. And at the moment, the most valid options are the detection of this misfolded alpha-synuclein in the spinal fluid or in skin biopsies. And the question is, what does this help for early diagnosis? So if you have a positive alpha-synuclein test, for example, in the spinal fluid, and you have a very specific constellation of prodromal symptoms, then we can actually tell that you have a risk of 80 up to 95% of developing Parkinson's disease in the future. So this really seems quite specific, but the problem with that is that there are actually a lot of buts. So first of all, if you get the message that you have an 80 to 95% risk of developing Parkinson's disease in the future, this is still not 100% certain, right? So you can have still 10 to 50% not getting the disease. So this is actually very important if you worry a lot that you get Parkinson's disease and maybe you will never get it, although we have this very high certainties. And what is also very important is that these certainties vary a lot. As I mentioned, this constellation going up to 95% is really for a very specific combination of, for example, test of the spinal fluid for alpha-synuclein and specific clinical symptoms. There are many, many constellations where we do not know yet what this actually means. So for example, if you have one family member and you have a positive test for alpha-synuclein, with our research at the moment, we cannot say for sure what kind of risk this means, or if you have been working with pesticides and you have a positive test. So there are many, many, many uncertainties, and it's very individual and very depending on the constellation of symptoms and tests you have. And there is another big issue, and that is really a very important one. We can say that the risk is very high, but we cannot define the time to the actual diagnosis of Parkinson's disease, so the time to the actually point where you get motor symptoms. And we've learned from the last years and decades that the time to diagnosis can be 2 years or 5 years or 10 or 20 years. And of course, this matters a lot for you. It's a really, really big difference if you get Parkinson's disease in your 50s or maybe in your 80s. So if we look at all these uncertainties, we really have to ask ourselves, do we really want to know if there's so many uncertainties, so many issues? And this is exactly what I want to discuss with you in the next minutes. And before I start weighing with you the pros and cons of knowing or not knowing, I just want to emphasize that there are a few basic principles if you want to get tested for Parkinson's disease or for prodromal Parkinson's disease that we all should have in mind. So you as an individual, maybe having some symptoms or signs or risk factors or concerns, you should have it in mind, but we as physicians also should always think of these basic principles. So first of all, what you should always take care of, ask yourself and your physician and your doctor the questions I will show you before you take any kind of test. Because if you had a test and you have the result, then the knowledge is there and you cannot delete the knowledge. So really, really ask yourself before, do I want to know the result of the test? And this is actually in clinical practice, and I've seen this for the last years, very seldom the case. So it's very often that we do some kind of test and then afterwards we think, maybe we shouldn't have done a test. So it's really important to keep in mind. Another very important aspect is take your time if you want to know your risk, because as I mentioned, Parkinson's disease is a very slowly progressing disease. We have years or decades. Of course, you don't have to decide if you want to take a test for clinical symptoms or a biomarker test within 1 hour or within a day, you can just take your time and think about if you really, really want it. And if you take the time, you can also take the time to talk to your family or friends if you want to. Again, it is very important that only if you want to. Every individual is different. And if you say, I want to decide this by my own, I don't want to have anybody involved, then just don't talk to anybody. This is also fine, but take the time to decide on that. And if you take a test, and this is very important, make sure that you will have a follow-up meeting to discuss the results. It's really a problem if you get some kind of results and nobody is talking with you about it. So really make sure that somebody who knows what the test actually means talks to you after you have taken the test, and maybe you can even have more follow-up meetings than only one. So these are the basic principles. So let's have a look at the pros and cons. So first, as I mentioned, the biggest con is there is so many uncertainties if you really get the disease and if you get the disease when you get the disease. So what is really important as this research field is evolving very fast, ask your physician the question, what can the test really tell in my individual case? Because it's really, really very individual depending on your kind of symptoms and risk profile. And also ask the question, what uncertainties currently exist? Because this can change rapidly within months, because research, as I mentioned, is growing so fast in this area of research. Just ask at the moment you are tested, what is really certain, what is uncertain? I want to give you one example. For example, we know that the test for alpha-synuclein in the spinal fluid is actually very good validated. But at the moment, the whole world is trying to test alpha-synuclein in the blood, and this is very experimental. So if you get a positive alpha-synuclein test in the blood, you need to know that this is a highly experimental test, and we do not know yet if this means actually anything. This could also be a false positive test. So really ask for a specific test and your specific profile. So let's go to the next con, and this is actually also a big one, the really huge issue that at the moment we do not have pharmacological treatment available to slow down or stop the disease in the prodromal phase or in the clinical phase. So on the one hand, you get the information that there is a chronic disease, a neurological disease coming up, but on the other hand, you do not have any treatment you get for it to stop it or slow it down. And this is, I think, the biggest ethical issue we have for early risk disclosure in Parkinson's disease. So ask yourself, is this okay for you, that you know that it will be no treatment? What you can also ask is, are there maybe any clinical trials? We expect clinical trials, for example, for REM sleep behavior disorder in the next few years. Maybe you can participate in a clinical trial, which might also be an interesting pharmacological option. And as everything is evolving so fast, you can also ask, are there at the moment today any new pharmacological options? Because this really might change your decision if there is anything new coming up. So what is also something you have to think about is that knowing that there is a risk that might come up might actually have potential psychological consequences for you. We know that from long-term studies from other neurological diseases that knowing that a disease will come can actually cause anxiety, can cause depression. So ask yourself the question, am I personally at risk for any psychological harm? I have already anxiety, and knowing that there might be something coming up might be, for me as a person, really big issue. And ask yourself if you can handle this information also in the long term, because as I mentioned, it might be years or decades if, until Parkinson's disease really develops. And there is a last con that might be important for the USA or might be important in different countries, which are potential legal or financial consequences that can come with this diagnosis. So for Germany, I know that it's actually not an issue because this field, prodromal Parkinson's disease, is not very well known in Parkinson's disease. Insurance companies are not taking it into account. but it could be an issue in your country. So you should really ask your physician, could the diagnosis of a prodromal phase of Parkinson's disease can have any implications for my financial situation, for example, for life insurance or whatever. So these are the four most important cons, but as always in life, there are also pros, and there are actually some really convincing pros that knowing your risk might be interesting for you. So let's have a look at these. So first of all, we have some symptomatic treatments for symptoms that can arise in the prodromal phase. Specifically for REM sleep behavior disorder, the ones of you that have it may know that it might need treatment because you can injure yourself at night. And it's very good to know if you really have this specific sleep disorder, then we can treat it. I've been following up individuals in the prodromal phase for a longer time now. And what I see is that sometimes they have so many symptoms that have to be treated. For example, a combination of depression and fatigue and REM sleep behavior disorder, that quality of life is really more impaired than when I actually diagnosed the clinical phase of Parkinson's disease. So having some kind of symptomatic treatment, working with an expert in the field might actually be might be a benefit for you. And what is also very important for your decision is that Parkinson's disease, once you get it, actually can be treated. As I mentioned before, today we can treat Parkinson's disease very well. We have pharmacological treatments and non-pharmacological treatments. We cannot heal Parkinson's disease, we cannot stop Parkinson's disease, but we can treat it very well. And this is a very important thing. If you think what is coming up in the next years, well, maybe there might be a disease, but this disease can be treated. The next big pro is, of course, future planning, because it might be good to know if you have plans coming up ahead, decisions you would like to make, if you know, well, maybe there will be a disease in the next future. So for example, if you think about having a job where you want to travel a lot, if you want to build a house somewhere in the mountains or whatever, sometimes it's good to know what's coming up for your future planning. And then there's something I see every day, and I think is a very good point. If you have been followed up with a diagnosis of prodromal Parkinson's disease, and then you get really clinical Parkinson's disease and motor symptoms, the diagnosis will be very fast and correct. So in Germany, we have to issue that the time point from having the first motor symptoms to actually being diagnosed with Parkinson's disease is between 1 and 5 years, which is really a long time, and a long time of suffering where you do not have the right medication, the right treatment, the right doctors, and so on. So if you're already followed up for prodromal Parkinson's disease, it's really helpful that you get a very early diagnosis and then right away the correct treatment. This is also a pro I see every day that's really an issue. And of course, there's the altruistic issue. I have a lot of patients who tell me, well, I do want to know what I can do for research. And what we know for the prodromal phase of Parkinson's disease, we only know everything that we know right now because we have had so many individuals, so many patients helping us with research. So if you're interested in that, again, you do not have to, but you can ask yourself, do I want to participate in any kind of clinical study? Can I maybe help research if I get tested? This can also be a pro argument. And finally, and this is my biggest issue, and I think this is the biggest issue of most of the sessions, is that we know that there actually is a treatment. We do not have a pharmacological treatment for the prodromal phase of Parkinson's disease, but we know very well that non-pharmacological treatments, meaning a change in lifestyle, can actually have an impact of the course of your disease. Of course, you can say, well, I can change my lifestyle anyway if I know my risk or not. But we as humans, most of the time, if we know that we are at risk, we are maybe more motivated to change our lifestyle. So ask yourself, would I change my lifestyle if I knew I have a high risk? And if you can say for yourself, yes, then this would be a really big pro argument. So these are the pros and cons. So maybe we can have a look what other individuals actually affected thought of this issue. There have been a few studies in the last 5 years. We started very, very late with asking patients and individuals at risk, but finally we did it. And these are two examples. These were two questionnaire studies with individuals with REM sleep behavior disorder. The one questionnaire study included 31 individuals, the other one 81 individuals. And the overall experience was that individuals with REM sleep behavior disorder mentioned that they have a strong preference toward risk disclosure. So most of them, over 90%, would have liked to know their risk or would wanted to know their risk. But they also mentioned personal consequences of getting the diagnosis. For example, over half of them mentioned that they actually felt some kind of anxiety about developing Parkinson's disease. So it is an issue if you get this early diagnosis. And 44% reported that they have quite some concerns about discrimination from employee, life insurance, etc. So most of them wanted to know the risk, but we always have to keep in mind it makes something with you. So there are some consequences that you have to face if you get to know your risk. What we also found very interesting was the attitude and the thoughts we got from individuals who already had Parkinson's disease. This was a questionnaire we did 5 years ago with around 100 individuals with already manifest motor Parkinson's disease. And we asked them, imagine you could have known your risk for Parkinson's disease years before you got the diagnosis. Would you have liked to know of your risk if there would have been no medical treatment to postpone the onset of the disease? So this is our current situation. We do not have medical treatment. We found it very interesting that, again, more than half of the patients asked, 55% said no, if there wouldn't have been any treatment, why should I have known so early? That wouldn't have been of interest for me. But if we asked them, would you have liked to know of your risk if you could have altered the course of the disease by changing your lifestyle, for example, with nutrition and with exercise, then suddenly 84% told us, well, yes, if I could have known earlier that my lifestyle actually matters for this disease, I really would have liked to know. And this is my most important aspect because we know that lifestyle has an effect on neurological diseases and specifically neurodegenerative diseases like Parkinson's disease. There are many, many aspects, but I just want to quickly emphasize again the two most important because they are so important for this ethical issue with prodromal diagnosis. We know most about exercise and nutrition, and we have many, many studies that showed us that if you exercise a lot, if you eat well, you have a significantly reduced risk for developing PD in the first place. If you get Parkinson's disease, and this is also very interesting, you have a later onset, so you get clinical motor symptoms later in your life, which might be an indicator that you actually slow down the disease in the prodromal phase. And we know that specifically for exercise, if you exercise a lot once you have Parkinson's disease, you have a better course of the disease. And this is absolutely for sure. I see this every day. So if we go back to what I mentioned in the beginning, that Parkinson's disease is an accumulation of specific protein of alpha-synuclein, this is only one side of the coin because there are many, many other aspects that play a role for the development and the progression of Parkinson's disease. And two more similar important factors are inflammation and oxidative stress. And that's why we know that lifestyle matters, because exercise and nutrition can reduce oxidative stress, can reduce inflammation. And we know very well for exercise that if you exercise a lot, this can actually lead to nerve cell growth. This can lead to the growing of new synapses, improvement connection of nerve cells. So we know from a pathophysiological basis that it works. And that's why when I see patients who work a lot with exercise and nutrition and the right pharmacological treatment, we end up here after 16 years of Parkinson's disease. So I have to mention what exactly I mean with exercise and good nutrition. I know that many of you may have heard of it, but just to quickly summarize the four most important principles. So for exercise, we know that moderate to high intensity exercise is best. The absolutely ideal situation would be 150 minutes per week. This is a lot for many people. So don't worry if you do not start with 150 minutes. Everything you do, every move you make is really important. Everything counts. If you take the stairs, this is already important. So the ideal would be 150 minutes moderate exercise, but you can also just let everything count that you do. And for the diet, this is also very simple. It's not that complicated. Maybe you've heard a lot about the Mediterranean diet or the Mind diet. These are just examples of diets that include a lot of plants, so fruits and vegetables as basic of your nutrition pyramid and a lot of fibers, good oils, for example, olive oil. And what we know really, really every year more, we have had already 4 studies this year, is that the counterpart is really ultra processed food, which is a booster for neuroinflammation, for oxidative stress. So it's actually a very simple trick. Try to eat a lot of plants and try to avoid ultra processed food, and then you are already on the right track. So what we hope that we can achieve, and that is good, and for that it's good to know that you're at a risk phase. If you use lifestyle, you can slow down this loss of nerve cells, and then you can postpone the actual start of the clinical phase and slow down the progression and the motor impairment. So, taken together, I want to conclude the most important thing is that it's your decision. If you do not want to make the decision, again, it's okay. You can ask your physician to help you with the decision, but nobody should decide for you if you do not want to. It's our most important principle that we have to respect the autonomy of patients, of individuals at risk. So you can decide, and you should take your time to decide. And maybe some of you joining us today already know that they're at a high risk of developing Parkinson's disease. Then I just want to emphasize, use this information because at the moment, how you live your life is the most important factor in this early course of the disease to get a very slow progression. This is the most important thing you can do. And I'm at the end, and thank you very much for your attention.
Thank you. What a great presentation. And I have some questions that have come in through the chat. But before we do that, we have some poll questions for our audience. We always want to be able to measure our impact. Did you learn something? Or are you going to take this information and talk to your healthcare team or your family? It really helps us evaluate our programs and also helps for our grants and getting funding for programs like this. So thank you for filling that out. And let me go back through some of the chat questions that have come up right from the beginning, and I'll get those all teed up. Okay. And there's still time too if you want to add more questions in the chat. Go ahead and do that. Oh, I love this wasn't a question, but this was a comment. Someone said that they are watching this webinar while moving right now on their stationary bike. So good for you. I've always thought about getting one of those desk exercising setups, and sounds like someone has figured it out. So, okay, I'm going to close that poll and let us get to our questions. Okay, I'll leave the slides up in case we need to refer back to them. So Neural asked, they came to learn about essential tremor and Parkinson's disease. Is essential tremor a risk factor for Parkinson's? They heard in a lecture that 30 to 40% of ET patients get Parkinson's, and they're wondering, should they pursue further diagnostics?
Yes, so I have to be honest, this number 30 to 40%, this has changed a lot throughout the last years. So we get different numbers every day. It's a big issue that this is a very good example of the uncertainties we still have. So a DAT scan makes sense if you have at least one of these cardinal motor symptoms for Parkinson's disease, because then you can say you have Parkinson's disease. This is the most important issue where you can have a DAT scan. And the DAT scan in the prodromal phase is very tricky because if you have a positive DAT scan, this is a strong indicator that you might get Parkinson's disease. But if you have a negative DAT scan, this does not rule out that you can have Parkinson's disease in the future. So what I would start with is search for a physician who has a lot of expertise in movement disorders, and he can check for all kinds of risk factors and prodromal symptoms. So this would only be a clinical examination and a lot of questions. And then he can decide, or he or she can decide very individual with you if more diagnostic or more tests really make sense at the moment, or if there's actually a very small chance that you get Parkinson's disease, which is also possible for essential tremor. So
Okay.
again, it's very individual and somebody has to see you and talk to you.
Mhm. And a being under the care and having the advice of a movement disorder specialist would be crucial, who's able to parse through all of the many studies and data and your individual situation. Um,
Exactly.
and for the audience, can you go over what a DAT scan is?
Yes, for sure. So this is a nuclear medicine imaging approach where you can actually see how the dopaminergic nerve system works in your brain. And a DAT scan is positive if you have Parkinson's disease, because then you have lost so many dopaminergic nerve cells that you can see with this particular imaging method that the dopaminergic system is impaired. If you have a positive DAT scan in a combination with other symptoms, for example, REM sleep behavior disorder, this is also a strong predictor that you might get Parkinson's disease. But again, there is a but. We have followed individuals with a positive DAT scan for years and years, and they didn't convert to Parkinson's disease. So again, this is very individual. But it's a strong marker that we can use in the prodromal phase to somehow decide how high your risk is.
Okay, thank you. Okay, so we had another comment. Their neurologist is very businesslike and cold. Great doctor and smart, but I don't know if we would have a good conversation. I think that comment was when around you were saying, talk to your doctor.
Yes.
Um, so can you comment on, I know it's not a question, but
Yes,
maybe
sure.
that opens
Now,
up some.
yeah, it's something that I can understand very, very well. So what you have to keep in mind, we have to learn also as physicians, and I really got to know that. So for many years, we were focusing so much on prodromal research, and we never asked the individuals how they actually feel about it. And I think we have to learn together. And there are still many physicians, many doctors that have in mind, well, I make the decisions, I decide for my patient. And this is an old way of thinking. We have to work together. I think if you prepare well, you can even talk to a, let's say, more colder or not that, yeah, um, or more colder doctor. I think if you prepare well and take your question with you and say, here, I have these questions, I really want to know this. I think this might be a good option, but of course we cannot change people. Some may still be hard to talk to, but this could really help, and maybe they can learn to get more involved and yeah, be more yeah. Sorry, I'm missing the English word.
Empathetic?
Empathetic. Thank you so much.
Yes, I know before we started, you said I've
Yeah,
been speaking French.
yeah,
My native tongue is German, and now we're in English. So,
yeah, exactly. I'm a little bit confused with the language at the moment. Thank you for your
yes.
understanding.
Yes. And okay, so there's a comment. So in your clinic, for example, are there social workers or counselors that you bring into the to have these conversations or help with them, or is it just the physician?
It's at the moment just the physicians, and I think this is also a gap that we need to fill, that we do not have social workers for that right now. What we do have are some very good patient groups, so individuals, for example, with REM sleep behavior disorder that meet online in Germany, and they know a lot, and this helps a lot. But there are a lot of gaps, so we do not have social workers at the moment.
Hmm. Okay.
It's a lot to do.
Yes, there's a lot, and that's
Yeah,
exactly why we're
that's why
here.
we're here. Yeah,
Mhm.
exactly.
And Sarah had a good question for patients who believe they may have prodromal Parkinson's. Do you have any tips for how to engage their doctor who might not feel comfortable managing someone in this stage?
Yeah, so actually, I can tell from my experience in Germany, we are really not many physicians who actually do know something about the prodromal stage. So it's really a very specific field of expertise. And I understand that a lot of neurologists, for example, are not comfortable with talking about the prodromal phase of the disease, of Parkinson's disease, because it's very specific and they do not know the facts at the moment. It's just a very new field of research. So what I always try to tell individuals who want to know their risk is try to find really someone with expertise in your area or even online, because this helps a lot. So in Germany, we are around, I don't know, 10 to 50 people really focusing on prodromal Parkinson's disease. And I always try to refer them when they call me in the specific places in Germany, because it's really a very new topic.
Yes, absolutely. Okay, I had a question come in a private chat. I have Parkinson's. I have a genetic marker. I keep telling my kids they should get their testing done. What are your thoughts about first generation children of people with Parkinson's? And um, I know I think I remember your slide about personal decisions, but wondered if you have any comments to share with this person.
Yeah, well, first of all, this would be prognostic counseling. And this is a huge ethical issue for genetics that have been discussed for many decades. Because this is also very individual. You know, there are very different forms of genetic background for Parkinson's disease. There are forms where you have, I don't know, 50% risk of getting Parkinson's disease, and there are forms where you can have, let's say, 1% risk of getting Parkinson's disease. So you really need to get a specific genetic counseling to be informed what tests makes actually sense and what the test might tell you. And then again, you have to say it's a very individual decision. I really had to learn it because for myself, I am a person, I would want to know everything. But I really had to learn that there are many individuals who say, no, why? I don't know. I want to live my life without knowing it. And I think we have to respect that. Even if they are our children and we want the best for them, or our parents, or a sister or brother, if they do not want to know it, it's okay.
Hmm, absolutely. And a question from Greg. Is it true that in Germany they are seeing a decline in the number of newly diagnosed because of the focus on good living and stop using pesticides?
Yeah, this is actually a fact. We see that Germany is one of the countries where the numbers of Parkinson's disease are not rising. This is the case in many, many, many other countries, but they're going down. We are not sure why this is the case. It could be that we had a lot of programs for heart disease, which includes physical activity and Mediterranean diet. And it could be that this is actually an effect for the good interventions and options that we have to prevent other diseases. But we do not know this yet, but it's a very interesting observation we have right now.
Wow. And Greg, great question. You are
Yeah, really
reading the
great question.
literature. You know what's going on out there.
Yeah.
Wonderful. Well, I think that is all of the questions that we have from the audience. I bet there's this is a topic to think on, reflect personally in your life, and your slides about what to factor in, how to weigh those decisions will be so helpful for all of us watching this live or people who are watching the recording. Um, Oh, okay. We have one more question. Do you see people who are successfully managing their Parkinson's risk information? And if so, what are they doing well?
Yes, I have to say, I'm amazed how great some are handling this information, and I have so great patients that are doing so much for their life. And the funny thing is that everything gets better. You have an improved quality of life no matter what. I have a lot of patients that use this prodromal diagnosis for doing a lot of exercise, being happy, spend more time with the family, decide in your life what really matters. Because we also asked individuals who got Parkinson's disease what they would have changed. And of course, everybody told us spend more time with the family, do something for yourself, travel more. And I see a lot of patients taking this very positively. And I think this is really, really great. So just use this information that you have a high risk to have a good life, take a little bit care of you, eat healthy, but also enjoy your life. So this is really, really great. No,
Yes, I'm
no
sure.
one said work more, really, no one.
No one said
No
work
one said that.
overtime, and
Yeah. Yeah.
great point. Well, that's really the spirit of, this series. We want to help people uh rededicate to be proactive to brain health, to a healthy lifestyle, exercise, nutrition, socialization, being happy, being mindful and grateful. So, thank you so much for joining us and bringing this presentation. And for our audience, I'll mention we have a couple more webinars coming up. And then also quarterly, we have the discussion group, kind of like a support group where after learning and hearing from all these presenters, we can talk with each other and, be with peers and kind of discuss out, how this applies to our own lives and what we're feeling. So, the educational webinars, the support group, we're here for you and really want to support all of this work in your journey. So thank you again, Dr. Schaeffer. Thanks to all of our attendees for your excellent questions, and we'll hope to see you at the next one. Bye now.
Thank you so much for having me.
Thank
Bye.
you.
Take care, everyone.